Welcome back. It's not an easy thing to talk about, but addiction recovery can be a long road with rewarding results. Here to help us learn more about supporting someone going through something like this is Dr. Tammy Malloy, CEO of Futures Recovery Healthcare. Thanks so much for being here, Dr. Malloy.
Thank you. Good morning.
So it must be a very hard conversation to bring this up with your loved one. How do you go about that?
Well, that would depend on two things. Are you just concerned about this person? Have you noticed a little bit of change in behavior? Do they seem a little sad? Are they missing work? Or is it a crisis situation? So those are two completely different things that are occurring. So it depends on if the family's in crisis or not.
So if the family is in crisis,
Yes.
What should be the next step?
Well, first you want to come at it in a very compassionate way. And sometimes it all depends on the person that's asking the questions. So I would say the person that's connected to that individual has the closest relationship, and someone that they're not going to get defensive with would be the one to approach it. But if it is a crisis, if they're noticing that there's neglect in the family, the responsibilities are getting neglected, they've lost their job, if there's substance abuse going on or severe mental health issues, if they're feeling like the individual has suicidal thoughts, homicidal thoughts, then you're going to have to get more support and more help.
What should one do if the person is very defensive when you bring up this conversation?
Start with less is more. So let's say that you have a feeling that they could be suicidal, or you have a feeling that they're abusing substances. First, maybe talk about getting a therapist if they don't already have one, and coming across in a more non-judgmental way. But again, if it's a serious situation where there are lives in danger or they're in danger, you need to call 911. And there's also, Florida offers a few different things. We have Baker Acts in Palm Beach County and in Florida, and we also have something called the Marchman Act as well. So those are two services that can assist with our court system.
And getting someone involuntarily.
Involuntarily. And of course, what we want is for that person to voluntarily admit that they have an issue. But that does not always happen.
No, it does not.
We need to stay calm when we're doing that. And I think also understanding that the family itself also needs support, because sometimes we forget about that.
Yeah, you're so right.
Yes.
Let's talk about the treatment at Futures Recovery Healthcare.
So we have residential treatment as well as outpatient treatment. So residential treatment looks like somebody coming in, spending 7 days a week all day. They sleep there. Anywhere from 2 weeks to get stabilized. So we have both primary substance abuse programs, and we also have primary mental health programs. So some come in for a few weeks to detox off any medication they're using, and that can also be prescription medication. It doesn't have to be necessarily a illegal substance. So they come in and they might stay for stabilization only. It's not really what's recommended, because generally there's underlying mental health issues as well. 93% have that. And so when they come in, we'd like for them to try and stay as long as they possibly can. That's not always what can happen. People have jobs and responsibilities. So we continue that continuing care in outpatient. And individuals can also come in just for outpatient as well.
Okay. How much do you see over at the facility just about people who are addicted to prescription drugs, who maybe didn't even know that they had that kind of addictive feature in them, and then go ahead and have a surgery or something like that, and then get addicted?
Yeah, so your body gets addicted to it, right? Whether it's, benzo, something like Xanax, or whether it's prescription medications for pain. So a lot of it's educating the individual. Some of that help happens on the front end. Somebody will call, sometimes a family member, and really just want information. We often help with that. Sometimes they don't even come into Futures at all. We help get them to the right place where they need to go. Sometimes they need more assessments to even determine if they need a residential level of care or outpatient level of care. But as they get educated, they start to understand. And it doesn't label who they are, but sometimes they feel like the word addiction does do that. And that's just our society. And
you don't let it define you, right?
You don't let
Absolutely.
it define you. Yeah.
So one more thing. Well, actually, I guess two more things.
Okay.
What do you want to say? What message do you want for someone who may be struggling with addiction right now?
Yes.
And also maybe a loved one who is interested in the facility?
Well, it's more prevalent than one thinks, and addiction and mental health does not discriminate. So I would say just give yourself the gift of getting help, whether that looks like outpatient, a life coach, going to traditional therapy, but working on whatever it is that's driving that addiction. And with addiction comes depression, comes anxiety. So just doing that for yourself. I think self-care is really important, and for the family as well.
All right. Well, thank you so much for being here, Doctor, and for all of your advice. If you'd like to watch this interview again and for more information, you can head to our website, WPBF.com.